we're going to start with the conversation about axial skeleton, and then we're going to move on to appendicular skeleton. Just a reminder, axial skeleton consists of the skull, the vertebral column, and the thoracic cage. Appendicular skeleton includes 4 limbs, pectoral girdle, and the pelvic girdle. We're going to start with the skull. So the vault of the cranium, the vault of the brain, is called calvaria. Calvaria consists of cranial bones that enclose the brain into that cavity. And if you will look into the base of the calvaria, there are 3 depressions: anterior cranial fossa, middle cranial fossa, so that's anterior, and posterior cranial fossa. Unlike cranial bones, facial bones here provide the framework for the face and the cavities for various organs of special senses such as eyes and nose. A plethora of foramina, canals, and fissures provide patent passageways for nerves and blood vessels. So we're going to start with the cranial bones. The frontal bone, numbered 1, contains most of the cranial fossa, anterior cranial fossa. Also contains superior wall of orbits and the frontal sinuses, the empty cavities that resonate when we speak. Frontal and parietal bones just 1 second. It's so annoying. Frontal and the parietal bones, whatever, are separated from each other. So this is your parietal bone here, and you can see parietal bone here. Parietal bone and frontal bone are separated by the coronal suture, and the sagittal suture separates parietal bones themselves. Occipital bone, shown here, forms most of the posterior cranial fossa, forms an articulation with a first vertebrae, so-called atlanto-occipital joint, provides the attachment sites for the neck and the back muscles, and is separated from 2 parietal bones by the lambdoid suture. Finally, the temporal bone, shown here, houses external acoustic meatus, has a couple of important processes, and is separated from the parietal bones by the squamous suture. So far we covered 4 bones: frontal, parietal, occipital, and temporal, and 3 sutures: coronal, which separates frontal and parietal bones; sagittal, that separates 2 parietal bones; and the lambdoid, 4 sutures. Lambdoid suture separates occipital and parietal, and squamous suture separates parietal and temporal. So here are some openings within the different parts of the cranium. So first of all, probably the most notable here is the foramen magnum. Foramen magnum is the opening through which brain stem passes. Then we have jugular foramen. Jugular foramen houses the jugular vein, one of the main vein that drains the blood from the head. Carotid canal, the entrance to which is shown here, is the passageway through which carotid artery goes and delivers the blood to the brain. Then there are two prominences, so-called occipital condyles. These articulate with the first cervical vertebra, forming atlanto-occipital joint. Styloid process, seen here and here, serves as the anchor point for the muscles that control the movement of your tongue and pharynx, effectively speech and modulation of the voice. And finally, the mastoid process, seen here and in a much clearer fashion here, is the anchor point for muscles such as sternocleidomastoid, splenius capitis, and longissimus capitis, which move your head. Two irregular bones that are found very deep in the cranium are sphenoid and ethmoid bones. So the sphenoid bone is shaped, some people say like a bat, I prefer a butterfly. It's a keystone bone, which means that it forms articulations with all other bones that comprise calvaria. A depression, shown here in the number 2, hypophyseal fossa, also known as stella turcica, or Turkish saddle, is the location where pituitary gland sits. This bone is prominent for several projections: so pterygoid process, lesser wing, and the greater wing. Actually, sorry, it's mixed up. So lesser wing will be this, number 5, and the greater wing will be number 4. Now the ethmoid bone is the deepest bone in the skull. Its cribriform plate forms the roof of the nasal cavity. As we discussed, the filaments of the olfactory nerve go through the cribriform plate. The perpendicular plate, shown here, forms the upper part of the bony part of the nasal septum that separates your nares, nostrils. Crista galli is the site of attachment for dura mater, the outermost of all meninges. Now we're going to switch to facial bones. The only movable bone in your skull and the largest bone in the face is the mandible, or the lower jaw. Okay, so its condylar process, on the number 2, articulates with the condylar fossa within the temporal bone, while coronoid process, and the coronoid process here articulates with the zygomatic bone. The upper jaw belongs to the bone called maxilla. Zygomatic bone? Okay. So maxilla is fused medially in the center. It houses the upper jaw, and you can see in both mandible and maxilla these little processes that separate the teeth. Those are alveolar processes. The palatine bone, which can be seen here, forms the posterior portion of the hard palate, also medially fused, and when the fusion fails to complete, usually in utero, the child develops what is known as a cleft palate. Few more facial bones. First of them is zygomatic, cheekbones. So this is the zygomatic bone, which articulates with the temporal, maxillary, and mandibular bone. Then we have nasal bones. Nasal bones form the bony bridge of your nose. Very small lacrimal bones are found on the sides, the medial border of the orbit, and I mean nothing particular. It has nasolacrimal puncta. Okay. Now another facial bone that you can kind of see here. You can see it up front, but it's a triangular bone, plow-shaped, so-called. It's called the vomer. Forms the inferior part of the bony nasal septum. And finally, inferior nasal conchae. They form walls of the nasal cavity, and those are the folds that increase the surface area of your nasal cavity. So, our eyes are contained within the orbits. So this is the orbit, and you can see which bones form the orbit. It is the frontal bone, the lacrimal bone, okay, sphenoid bone, a little bit of ethmoid bone, maxillary bone, zygomatic bone, and I think I ran out of bones, and a little bit of the palatine bone. Okay, palatine. Contribution of palatine bone is rather small. Okay, so there's a bunch of openings there. If you look at it, for instance, there's an optic canal shown here. This is where your optic nerve gets. Your optic nerve reaches the brain through the optic canal. And then there's a superior orbital fissure. There's pretty large opening here. It's a site of passage for a whole bunch of cranial nerves, such as oculomotor, trochlear, trigeminal, and abducens nerve. Now, within frontal, maxillary, sphenoid, and ethmoid bones, you're going to find air-filled spaces called sinuses. They make your skull lighter, and also enhance your voice. Okay? On top of that, they warm and humidify air that you inhale, if you inhale it properly through the nose. When somebody develops sinusitis, sinuses become clogged with snot. The absorption of air from the sinuses reduces the pressure in them, and this is why they hurt. Somebody has very, very badly stuffy nose. Pressure on the maxillary sinuses or frontal sinuses, so sides of your nose or on top of your nose, that pressure will be fairly painful because of that absorption. Now, an interesting bone here called hyoid bone is the only bone in the body that doesn't make any contact, it does not articulate with any other bone. This bone provides the base for the tongue. Muscles that control your swallowing and speech are attached to that bone. Without causing gag reflex, probably won't be able to touch it. It's fairly deep within the neck. Now we're going to move on to the vertebral column. So the function of the vertebral column is to distribute the weight of a trunk over the lower limbs and to protect the spinal cord. It consists of 26 vertebrae. There are 6 cervical vertebrae. I'm going to emphasize on that image also the curvatures. Let me make it a little thicker. I think it's going to be. So this is the curvature of the cervical part. There are 7 cervical vertebrae. Then we have 12 thoracic. Then we have 5 lumbar. And then we have a sacrum. Sacrum consists of 5 vertebrae that are fused together. And then at the very end of sacrum is coccyx. The tailbone. Now if you look at the curvatures that I highlighted, you can see that I can pretty much draw a spinal column like this. Okay? So what is the reason for those curvatures? If you will try to jump off the table and land on the absolutely completely extended legs, you're going to hurt yourself. However, if you land and allow your knees to bend, it's going to be fine. So the function of these curvatures is to provide that amortization. They act like a very weird type of a spring to reduce the vertical compression forces that act on your spinal column. Now, one little thing, and I'm going to make a very bold attempt to draw a baby. Don't take it seriously, please. The baby is going to be positioned horizontally. That's the baby. Very young baby. The back has one curvature. Does that make sense? So why is that? They're missing the cervical and the lumbar curvature. When do babies develop cervical curvature? When they start doing what? Huh? No, not too early. Too late, huh? Raising the head. So if you put a baby on the belly, at some point they start lifting their head. That's when the muscles form that cervical curvature. Because they don't have, you hold baby's head at the very young age, because they don't have a muscle strength to hold their head, and that made, yeah, it just wobbles around. Okay? Then they start holding it, cervical curvature develops. Then when they start standing, that's the lumbar curvature. So main pathologies of the curvatures. One of them is scoliosis. So that's the lateral curve. You see, this is some pretty bad scoliosis. I actually had a student at Lakeland. When she saw that picture, she said, I had this. They had to surgically fix it. Then kyphosis, hunchback. Apart from legitimate, say, developmental reasons, you may notice that older people tend to develop that posture. Why is that? Because, okay, if I sit like this all the time, will I develop kyphosis? I will not. Mm-hmm. But the main thing that contributes to the kyphosis is weak back muscles. And I'm not talking I'm not suggesting that you should, go in the gym and become the world champion in deadlifts. But it's been shown that resistance training and strong back muscles prevent the postural abnormalities. Now, lordosis is usually temporary problem. You develop lordosis basically when you carry heavy things. If I would start carrying, I don't know, a sandbag that weighs 100 pounds in my arms, I would do this to counterbalance the weight. Pregnant women usually have lordosis, and it goes away once the pregnancy is over. So in vertebral column, the vertebrae are separated by intervertebral discs. Intervertebral discs have two layers. The external, called annulus fibrosus, and the internal one called nucleus pulposus. Nucleus pulposus, basically, nuclear pulp, contains soft gelatinous mass. The outer collar, annulus fibrosus, is composed of the fibrocartilage. Remember, fibrocartilage is very resilient to the vertical pressure. We doing good? So again, when you start thinking about the function of your vertebral column, that makes perfect sense. You encase a gel-like, very elastic, very buffering mechanically structure with a super tough fibrocartilage. Think of it as like a sole of a shoe which has like gel cushion, whatever. That's pretty much the same idea. Now, while intervertebral discs are very good at reducing the vertical pressure, the amortizing vertical pressure, they're not very good resisting the lateral movements. So sometimes intervertebral disc can become herniated. For instance, when somebody doesn't lift the weight properly, there's some slipping, and what happens is that hernia starts compressing the spinal nerve that goes through the intervertebral foramen. That pressure causes pain and potentially dysfunction of the muscles and sensory component. Okay? Now let's take a look at a generic vertebra. So vertebra, the main part of it is the body, which has weight-bearing functions. Then there is a vertebral arch. Vertebral arch consists of the lamina and the pedicles. Vertebral arch and the body form sort of a central part of a vertebra. And then there are several processes. There is a spinous process. If you touch your spinal column through the skin on the back, those, bumpy things are spinous processes. Then there are transverse processes, which stick out. You can't really kind of feel them, but transverse processes provide the site for the articulation with the ribs. And then there are articular processes. Superior, and do we have inferior? Yeah, inferior process, but it's not very clear here. So now listen to me. I want to instill in you that the word articular means that there's a contact between two bones there. So superior articular process contacts with the inferior articular process of the upper vertebra. Okay? So this is like, if you look at this image here, this is the inferior, this is the superior, this is the inferior, this is the superior. What about foramina? So there are two main foramina. One is vertebral foramen, and another one that we already mentioned, intervertebral foramen. Vertebral foramen is where your spinal cord is. Intervertebral foramen is for the spinal nerves. Go ahead.
So when a chiropractor cracks the back, what part is the other?
I don't know. I'm not a huge believer in chiropractors, to be honest. Holistic medicine is a different story. There's several definitions to holistic medicine. One of the one that I kind of like, holistic medicine takes into account not only the disease but also socioeconomic determinants of health of a patient, and looks at the patient not just the body has a dysfunction, but looks at it in complex. That's holistic medicine for me. It's scientific concept. Yeah, so like if somebody comes to me and tells me that they are bulimic, I'm not going to treat bulimia. I'm not going to treat anything. I'm not an MD, but treatment should not only include, here's the drugs, but also what made you. Let's find the root cause of this, okay? Or, I can't come up, okay, somebody has type 2 diabetes. What's your food situation? Do you have time to make salad? Okay, you do, but can you get to the grocery store? Okay, now it's not a problem. We have Instacart. Like, do you have access to the proper foods? Am I making sense? Are you educated enough? That's holistic medicine for me. Rather than some weird, obscure, and sometimes the terms get used in a different context, which I'm fine with, but that just, chiropractors, that's a complicated issue for me. Okay, I don't honestly think of them as like physicians, very skilled workers. Okay, and they can do good. Sometimes they can cause harm. Just take a look at the structure of specific vertebrae. Now, full disclosure, on the exam, the anatomy exam, you will not need to identify, like I show you a vertebra and you tell me, like single vertebra, and tell me, this is C5. God forbid. you need to distinguish cervical, thoracic, and lumbar. And make sure that you know how cervical 1 and cervical 2 look like. So this is the garden variety cervical vertebra. Distinctive features. First of all, the body is light. The body is light and relatively small because they only carry the weight of your head pretty much. The vertebral, for God's sakes. The vertebral foramina is pretty much triangular. Transverse processes are relatively short. Spinous process is bifid. So you see these two horns. And cervical vertebra have a feature that none other has. They have these openings called transverse foramina. I am challenging you to tell me which cranial nerve goes through those openings. So the nerve goes like this. Which cranial nerve originates in the spinal cord, enters the cranium, and then leaves the cranium? It's kind of a debatable nerve because anatomists don't know if it should be cranial or because it's not originating in the brain. It is considered a cranial nerve now. Accessory. It's an accessory nerve. So those transverse foramina are passages for the accessory nerve. Now these two, and I can tell you, most of the, so all the images from the study guide will be on the exam, and a lot of them are in this PowerPoint. So first of all, this is your, where is your, here. This is the atlas, the first cervical vertebra that forms an articulation, a joint, with the occipital bone of the skull. You can clearly see the transverse foramina, but you can see that it has no body. This vertebra has no, like, body should be here, and it's not. Also, it doesn't have really clear spinous process. So these surfaces called lateral masses articulate with occipital condyles. Now, this number 2 is axis, second cervical vertebra. This extension called dens sticks in this space in the first cervical vertebra, the atlas, effectively becoming a body for it. And then there is this ligament here called annular ligament. Now let's think about what happens if you put a cranium onto these lateral masses. Look, you will be able to move the cranium like this, frontal, and then back. So Atlanta occipital joint provides the movement for saying yes. Annular ligament. Here it's marked as a ligament, but it's annular ligament. So this arrangement, when you have effectively the axis around which the first cervical vertebra, the atlas, can move, the Atlanta axial joint, the joint between the atlas and the axis, enables you to say no, to move your head from left to right. Thoracic vertebrae. Well, they carry more weight, so the body is bigger. The vertebral foramen, sorry, I had to pick this image from Gray's Anatomy. So the term is, no, seriously. It was free. The term was back then spinal framing. Yeah, I thought about the book. I don't know what you were thinking of. Transverse process is fine. Spinous process. Look at the spinous process. You see how it is pointed inferiorly? Okay? And then there are articulate processes. Superior. Do we see inferior? Not as much. So in this photograph, which I took myself, this is superior articular process. And these are inferior articular process. If you will, and you will do that, you will put one thoracic vertebra on top of another. They can move, they can rotate. This is why you can turn your trunk left and right, because they can rotate. Okay? These processes do not block each other. Finally, the lumbar vertebra. Biggest body. When you look at it from this side, I have a question for you. What does it look like for you? Does it remind you of anything? What? Okay, that's often called, this part is often called a hatchet. I call it moose head. I mean, it does. Like, antlers. You see? It's a moose head. So, big body. Vertebral foramen. Again, not circular, but more of a triangle. Hatchet-shaped. Spinous process. And the superior and inferior articulate processes are looking each other. So there is no rotation of the spine in the lumbar region, which makes perfect sense, because this is where the most of the vertical compression, most of the weight is carried. And any movement can be detrimental for intervertebral discs. Finally, sacrum and coccyx. So, sacrum is on the right. These are 5 vertebrae that are fused. The sacral promontory is the articulation between the sacrum and the 5th lumbar vertebra. The surfaces here, they kind of, this called auricular surface, but it's also known as the place for iliosacral joint between your coxal bones, the hip bones, and the sacrum. And these openings, called sacral foramina, are passageways for the sacral spinal nerves. Now right here you cannot see it on the image itself, but there's a canal. That canal houses the assembly of the extension of spinal cord known as cauda equina. No. The body is this surface. What I'm trying to show you is that there is an opening, which you can see. You have, actually, you probably can find it. You have pelvises. If you look on the tables, if you look at the pelvis, and you look on top under the lumbar vertebra, there's going to be maybe a sacral canal. Yeah. Yeah, under the lumbar vertebra, yes. So coccyx or the tailbone, do you have tails? Do you have tail? Do you have a tail? No. You still have a tailbone, though. Why? So again? Well, it's a vestigial structure, but it turns out it's not that vestigial, because that coxal bone provides an attachment site for the muscles that control your pelvic floor. Effectively, urination and defecation, incontinence, is the weakness of the muscles of the pelvic floor. So just, it's functional. Now, let's talk about thoracic cage. So you have ribs, you have sternum. Let's start with the sternum. Bones are manubrium, body, xiphoid process. Jugular notch is the depression in the upper border of the manubrium, and sternal angle is what separates the manubrium and the body of the sternum. Xiphi-sternal joint is the line that separates xiphoid process and the body. Sort of a piece of trivia, folks. Xiphoid process is the last bone in the human body that becomes ossified around age of 40. Okay, so let's talk about ribs. Well, 12 pairs of ribs. Males and females have the same number of ribs, regardless of what Genesis tells us. First 7 ribs, we count them 1, 2, okay, let me find some better color. That's not better color. I don't know what color would be better. 1, 2, 3, 4, 5, 6, and 7. These ribs are called true or vertebro-sternal. Why vertebro-sternal? Because your ribs articulate with the sternum through the costal cartilage and with the spinal column. So vertebro-sternal. Now 8 through 12 are false ribs. Specifically 8, 9, and 10, sometimes called vertebrochondral ribs, because they are indirectly attached through a really long chain of cartilage to the sternum nevertheless. And the other end faces the vertebral column. Now 11 and 12, and we can't really see 12 clearly in that image. 11 and 12 are called vertebral or floating ribs because they are attached only to the spinal column. These are the ribs that some people surgically remove to make them look more like a Barbie. So that is the end of axial skeleton, and we get into the appendicular, right? So here's the appendicular skeleton. We're going to start with the upper part, upper limbs. The limbs are braced by the pectoral girdle. The pectoral girdle, pectoris, the chest. Pectoral girdle consists of clavicles and scapulae. So this is your typical clavicle. which has two ends. The end that is shaped like a cone, since it's a photograph, you can't really see it, but you will touch it later. This is the sternal end, articulates with the sternum, and the flat acromial end articulates with the acromion or acromial process of scapula. When you start looking at the scapula, and this is the posterior view, you may notice that, first of all, there are several borders. So there is a lateral border of the scapula, medial border of the scapula, and superior border of the scapula. There are three angles: lateral angle, superior angle, and inferior angle. And then there is a spine. So this and this, the spine on the scapula. Spine gives rise, well, scapula has two processes. One of them is acromial process that articulates with the clavicle, and another one is coracoid process. Finally, the depressions on the scapula also have names. So you have supraspinous fossa, under the spine. Sorry, infraspinous fossa, under the spine, my bad, infraspinous. Supraspinous fossa, above the spine, that's the spine, remember. And subscapular fossa, which is the fossa located on the anterior aspect, okay? The depression, the shallow depression that articulates with the humerus, is called glenoid cavity, and it forms your shoulder or glenohumeral joint. Now we will talk upper arm. Okay. So the upper part of the arm, from shoulder to elbow, is composed by a single bone called a humerus. Head of the humerus articulates with the glenoid cavity of the scapula and is separated into two tubercles, the greater and the lesser. Those are projections caused by the attachment of muscles. Okay? They are separated by intertubercular groove. And then I'm going to highlight what you need to know. On the distal end of the humerus, you can clearly see several structures. One of them is capitulum, the site of articulation with the bone called radius. Trochlea, remember trochlea means pulley, so it articulates with the ulna. And then olecranon fossa, that articulates with olecranon process in ulna. Now, this is the anterior view. This is the posterior view here. You can see, I'm sorry, my bad. It's not, since it's anterior view, it's a coronoid fossa here. So this is olecranon process in ulna. You can't see it there, but there is a depression, okay, that olecranon process goes into, and this depression is right here. Okay, so that's olecranon fossa. Does that make sense, y'all? Now this is medial epicondyle. the attachment for muscles that mostly move your wrist and fingers. Now, when we move on to the bones of the lower arm, there are two of them. There is ulna, which is medial bone. And if you look at ulna, I'm going to blow up my photograph. So this is the trochlear notch. This looks like somebody opened the mouth on that image, right? Lips. Anyway, that is olecranon process that fits into olecranon fossa. This is the coronoid process that fits in the coronoid fossa. Okay, so what's interesting, I think, is that the head of ulna is actually distal. Okay, so when you look at this arrangement, humerus is right here. The head of ulna articulates with your wrist, with your carpal bones. Radius is the opposite. So the head of radius articulates with the capitulum on the humerus. And you can see that radius and ulna are connected by this interosseous membrane. Now we are getting into carpals and metacarpals. So I have good news for you folks. On the anatomy exam, questions about carpals and about tarsals are extra credit. Because it's hard. Like, if you can master them, good for you. If you can't, it's not going to affect your bottom line, you know? So, how about this? We're going to knock out phalanges and metacarpals because that's super easy. And then we're going to address carpals. Clear? So, the bones that form your palm are metacarpals. They are numbered from 1, thumb, to 5 on the pinky. Easy peasy, right? Like if I tell you, like, what is, well, you won't be able to see the picture, but what is this bone? It's a first metacarpal. That's it. Phalanges are also not particularly complicated. So when you start looking at the phalanges here, so these are proximal, these are medial, and these are distal. Please notice that your thumb only has distal and proximal, no medial. Numbering principle is the same. Am I clear? Now I'm going to try, oh, hold on a second. It does it all the time. This is the photograph of a model, okay? The hand model. Please, please, please. It's so annoying. Okay, so what I'm going to do, this is the photograph, right? And that is the photograph of the right hand, and it's taken, yes, This is the right hand. This is the anterior view of the right hand. Okay? Do you mind if I'm not going to show you phalanges again on that photograph? Is that okay with you? Yeah? Okay. In this case, we're going to try and focus on the carpals. So this is your number one. This is the thumb. Okay? And there are 2 rows of, sorry, second one was wrong. 2 rows of carpals. So this is the distal, sorry, this is the proximal row. This is the distal. And to make it even better, I'm going to give you a mnemonic rule while going through those rows. So you start at the proximal row at the thumb. And this is the bone. I'm going to call it it's going to be S. His bone. S is a scaphoid bone. And the first letter is some. In the mnemonic rule, I mean. Okay? Then we go to that bone, the L. Lunate. Lovers. Okay? Then we go to the bone that you can barely, well, it's not very well seen because of the vantage point, but this bone is called triquetrum. Try. Finally, this small bone here pisiform, concludes the first part of our mnemonic rule with the word positions. Now we're going to return back to the thumb, okay, and start the distal row. So we're going to call this bone because it also starts with T. Okay, we're going to call it TR. So TR is trapezium, and that gives us the word that. Next bone, unfortunately, also has the first letter D. We're going to call it TD for trapezoid. Finally, this bone, which kind of looks like a Darth Vader helmet, starts with C. It is capitulum. And the last bone, not capitulum, sorry, capitati, my bad. I mixed up with the part of the... Come from the same word though, meaning like head. And finally this bone, the H. Completes the list with the mnemonic rules, some lovers, try positions that they cannot handle. Okay? So these are, these are the carpal bones, remember? Extra credit on the exam. And now we can move to the lower limbs, starting with the pelvic girdle. So the pelvic girdle, or the pelvis, is formed by sacrum and coccyx, coxal bones, and its function is to attach the lower limbs to the axial skeleton. It also transmits the upper body weight to the lower limbs, supports pelvic organs, supports fetus during the development, and forms the hip joint. So within the coxal bones, coxal bone can be presented as sort of a combination of three other bones. Ilium, ischium in the back, and pubis in front. So when you start looking at the coxal bone, you can notice some elements worth knowing. So first of all, this flat surface here is the sacroiliac joint. The iliac crest provides the site of attachment for the muscles that flex your trunk, in other words, your abdominal muscles, such as obliques. Greater sciatic notch, seen here, is the passageway for a sciatic nerve, and the acetabulum is the site of articulation with the femur, the bone that comprises the upper leg. In the ischium, ischial spine, ischial tuberosity provide the sites of attachment for the muscles that flex your hip, such as iliacus and psoas. Lesser sciatic notch, seen here, is the passageway for the pudendal, one of the sacral nerves. Finally, pubis. Pubis here, the frontal part of the coxal bone, forms two pubises, two different coxal bones, form a joint called pubic symphysis. It also contains obturator foramen, which is a passageway for multiple muscles, blood vessels, and nerves. Now, pelvises, male and female. So female pelvis is adapted for carrying a fetus. Okay, you can see that this cavity below the pelvic brim is shallow and broad, which suits well carrying a baby. Okay. Male pelvis is more forward tilted. Okay. And basically that being sort of narrower and more tilted forward, it's better to carry, better suited to carry usually heavier male body. Male? You're right. It's tilted less forward. Yes, you are correct. Yes. Probably, yes, because it's more vertical. We will hopefully we will compare. I can see from here whether it's a male or female. Those are male pelvises, I think. Yeah, those are male pelvises. One of the easiest way to determine whether it's a male or female pelvis is the subpubic or pelvic angle. Males have more acute angle, and usually if you deal with a male pelvis, if you spread your index and middle finger, like you're showing the victory sign, that's enough to match the angle on the pelvis. If you have to physically move those fingers wider, that's probably female. Femur, largest bone in the body. Quarter of your height. Tidbit in terms of the strongest bone in the body. It can withstand a vertical compression equivalent to, like, if you put a minivan on it. It's fine. It's not going to snap. Okay? So the head of the femur articulates with the acetabulum of the hip, forming hip joint. The condyles of the femur articulate with the, surprise, surprise, also condyles on the tibia. Okay? So far makes sense? Now here you have trochanters, attachment sites for muscles, as well as gluteal tuberosity, linea aspera, and epicondyles are muscle attachments. Right now, what I want you to know, head, neck, greater and lesser condyle, 2 condyles, 2 epicondyles. Now, if you will look at the image on the left, you may notice that femur does not articulate with all 3 bones that are located inferior to it. Femur does articulate with the patella. It does articulate with the tibia, but there is no articulation with fibula. And I wouldn't say the reason for it. No reason. That's how we evolved. But the tibia is the only weight-bearing bone in the lower leg. Does that make sense? So the entire weight of the body that is transmitted to femur is also transmitted to tibia. Fibula is not weight-bearing, doesn't articulate with the femur, however, does articulate with the tibia. Just like radius and ulna, these 2 bones are connected by this interosseous membrane. You can see tibia and fibula here. If fibula does not bear any weight, what is its function? It does have a function. It doesn't bear weight. Primarily, no. When we move, what is it like when we go, like walk around, jump? What moves us? And what are they attached to? There you go. It's muscle attachment. Okay? Foot. Some of it is super simple. Let's see if Okay, it's good. I'm gonna skip the generic picture, okay? And I'm gonna show you the stuff on this. So first of all, these are metatarsals. When you start numbering them, where do you start? Come on, huh? Big toe. 1, 2, 3, 4, 5. These are phalanges, okay? Distal, proximal. Medial and distal. So far, does that make sense? Now, I misplaced medial because big toe does not have medial phalanx. Any questions on the numbering? Okay, now let's get to tarsals. Remember, this is the superior view. Okay? You look at that's the foot as you look at it from the top. So this bone right here is talus. It articulates with the tibia and the fibula. This is calcaneus bone. It forms your heel. Calcaneus bone articulates with the cuboid bone, while the talus articulates with the navicular. Do I have a good mnemonic rule? I do not. How I learned this? 2 C's, so C, C, and then there's T and N. So TN is the acronym for U.S. state of Tennessee. So it's a pretty stupid mnemonic rule, but CC, Tennessee. Finally, you have these 3 wedge-shaped bones. When something is wedge-shaped, anatomists use the term cuneiform, okay? And these cuneiform bones are medial, lateral, and intermediate. So now, if you look at a foot here, foot has 2 arches. One is clearly seen, okay? It's a lateral longitudinal arch. Medial longitudinal arch is here. And you can presume that there's a transverse arch that kind of goes across. When you have an arch-shaped structure, that improves the ability of a foot to carry weight. Does that make sense? So as a person, and I don't just have, I'm kind of proud about it. As a person who has extreme flat foot, how would I know that it's extreme? I went to an orthopedic surgeon a couple of years ago because I injured my ankle very badly. And it's never good when an orthopedic surgeon tells you, hey, drop off your shoes, and I think I was in shorts. So drop off your shoes and walk. And I drop my shoes and I start walking, and the first thing that he says is, whoa! Like he never saw it before. It's bad. My feet are to the sides of my legs. Same emotion was expressed by the physical therapist. My left lower leg is visibly thinner than my right. I mentioned that, like, because I cannot bear weight on my left leg as much. If I will compare how much time I can stand on the left versus right, left is off. Left is absolutely flat. Just totally flat. Which means, interestingly enough, I can't stand for a long time, but boy, I can run, I can walk, I'm fine. As long as I'm moving fast, I'm fine. Any continuous stretching effort when I have to stand, horrible. And shoes are pretty darn expensive, especially running shoes. I mean, I use the insoles. Otherwise, like, it kills me. So, and interestingly enough, it's genetic. It's genetic. It is genetic. My mom, my brother, me, all flat-footed. Okay? So, just a quick developmental thing. Very few. First of all, look at the rate of growth for the head compared to the body. See that? When a child is born, like this is 2 years, when a child is born, you know how much of the child's, I wouldn't call it height because they don't stand, length is their head? It's a quarter. Quarter of an infant length is the head. Then head grows, yeah, it about doubles the size. But your body, oh, way more than that, right? You're born like what? How many inches? I don't know. 20-something inches, whatever, right? And then you grow to be like 60 inches tall. Yeah, it's pretty remarkable. Now, we mentioned primary and secondary curvatures. I'm not going to talk about it when we talked about the spinal column, but there are 4 fontanelles in the skull. So we've got the anterior fontanelle, the posterior fontanelle, the mastoid fontanelle, and the sphenoid fontanelle. These are places where the bones, cranial bones, do not get too close, and the spaces are filled with the membrane. Eventually, those fontanelles ossify. What is the function of those fontanelles? Like, why a child needs that? Go through what? No. No. Birth. The process. Like labor. Vaginal canal is pretty tight. You know? And it's kind of evolutionary for the benefit of both a child, because it can, like, you know, there's a wiggle room a little bit, and for a mother, because it's like you're not ramming a solid skull through the cervix and the vagina. There is some adoption of the space, okay?